8:22, we do want to welcome you back this morning. This is new. Pharmacies across the country are struggling to fill Adderall prescriptions. We've been talking about that. But in October, we told you about the FDA announcing a shortage of that medication.
Fox 35's Randy Hildreth spoke with pharmacists to find out what's causing the shortage and how local drugstores are trying to work around it.
Psychiatric nurse Dr. Joan Burns has a new expectation when she goes into work.
Easily 10 to 12, if not more, messages from patients requesting ADHD medication changes or doc, I can't find it. What do I do?
It's panic felt by ADHD patients across the country after an Adderall shortage was announced in October. And looking through the FDA website, some companies still list prescriptions on back order or say issues may not resolve until next year. The drug is used to help children and adults focus on day-to-day tasks, which Dr. Burns says is hard without it.
And a lot of work now is measured by metrics and productivity. That starts to go down. And as employers are cutting staff because of the economy, who's going to be the first on the chopping block?
She believes there's more than one reason for the shortage. First, increased demand. For example, a report from the research firm Trilliant Health found prescriptions of Adderall for people between 22 and 44 years old increased by 15% from 2020 to 2021. The report said the abrupt switch to remote work and school during the pandemic was associated with an increase in families seeking ADHD treatment. The second reason, safety restrictions. At the top of the supply chain, drug regulators limit how many pills a manufacturer can make because Adderall has a high abuse potential. And then local retailers apply quarterly for how much they believe they'll need. Even if they get more customers, they can't order more pills until the next quarter.
Definitely don't want to negate the importance of having safety features like that, but that does create a hang-up.
Clinical pharmacist Dr. John Roger Accardi also says the workforce at the manufacturing level is still rebounding from the pandemic.
1 month supply, or say 30 tablets or capsules, we may not have that in their particular brand, and so we give them, well, let's say 10.
He runs a compounding pharmacy in Volusia County, and in the days before Thanksgiving, his techs were calling wholesale suppliers to find the raw ingredients to make Adderall in-house.
This area is meant for the making of medications where they're not commercially available.
His pharmacy tech, Pedro Martin, says the office plans to complete the clearance paperwork, and he'll start the math calculations to make the drug.
I'm getting a lot of patients that are looking for Adderall. And unfortunately, we can't take new patients because of the shortage.
Back at Dr. Burns' office, she's working through her to-do list of switching patient prescriptions to different pharmacies where there is some availability and walking patients through other treatment supports.
Combined with lifestyle interventions, are you getting enough sleep, eating well-rounded diet? But again, that only carries folks so far.
Randy Hildreth, Fox 35 News.